I want to speak to Dr. Johnny Bloomfield because apparently on TikTok they're going buck mad for this new initiative whereby you can sleep with tape, like sellotape, over your mouth. Now, I'm not recommending this. The doctor can talk us through it. It's generally a safe assumption, obviously, that any health advice that you find on social media could be taken, as my producer Robert told me earlier, with a sizable pinch of salt. And indeed, we have to be cautious in relation to any of these issues that we talk about. But some people are claiming that if you do sleep with your mouth taped, you improve your jawline, you improve your skin, you improve your mood, your digestion, and the quality of your breath. So let's talk to Dr. Johnny Bloomfield. Johnny, good morning.
Hey, good morning, Frank. How are you? This morning?
I'm good. Johnny, are you going to suggest to me maybe there are some pluses in taping our mouths, breathing through our noses?
I'm afraid I'm not going to do that. Certainly not on the radio either, Frank. Not this morning. I've noticed this craze, particularly over the summertime. There's been a lot of celebrities taking these selfies of themselves with their eyes closed and in their kind of pajama wear and clearly having their mouths taped closed. And there isn't any scientific evidence behind supporting the benefits of this. Everything so far to this point, because it's very new, it is very anecdotal. But I thought it would be certainly a healthy topic for us to kind of kick around on this morning's radio.
Yeah, James Nestor, who's the science and health writer, he says there's zero evidence that it will give you better skin or a tighter jawline. I've just trying to visualise my sleep pattern, and if I had my mouth gagged in bed, I don't think I could perform properly at all. I'd be breathing through my nose. No, I definitely have to get my tongue out and about and wriggle it, get a good old deep breath when I'm at it. I wouldn't trust myself to sleep with a taped mouth.
No, and let's actually go one step further. It could actually be very dangerous for some people, certain individuals, to sleep with their mouth taped. I mean, at the end of the day, it is an airway, and just saying it, deliberately closing an airway while you're unconscious, that just does not sound like a sensible thing for anybody to really be doing. It's startling, this craze on TikTok. I see the hashtag as of mouth taping has got over 50 million views. But one of the
which one is over 50 million views? What's that one?
A hashtag called mouth taping, and this is specifically to do with mouth taping while you sleep. So it's viral. It just takes maybe a few well-known famous people or celebrities to be posting those images or endorsing this behaviour. And unfortunately, when it comes to medical advice, it's in everyone's best interest to have a personalised conversation with your primary care, your GP. Don't just simply follow a fad that you see online. Oh, I think that, if such and such is doing that, I should also be doing that. I would strongly advise anyone who's considering doing mouth taping at night to have that first conversation with their GP just to see if they might be a suitable candidate, whether they will gain any benefit from it, and how to do it safely as well. So don't just pick up on a craze and self-medicate, basically.
Yeah, there are some agents about, and we found that during COVID, of course, just how many balloons would be coming to the party. Scientists at Stanford in America, apparently, such as Anne Kearney, a voice and swallowing expert, says that mouth taping may help people who snore, and they say there are definite advantages to nose breathing. It filters the air and activates the lower lungs, allowing you to take deeper, fuller breaths. And then there's a massive but it has not been properly studied or trialled. Some of the claims are less definitive, and it goes on to, like yourself, advise people to think long and hard before changing their sleep patterns, because if you do change a sleep pattern to that dramatic extent, you could end up choking.
Yeah, what concerns me is wives taping up the snoring husband, and that snoring husband could very well have obstructive sleep apnea, which we've talked about previously on the radio. I mean, it affects nearly a quarter of the UK. It's estimated around 25% of the general population of the UK would be positive for obstructive sleep apnea. Yet 90% of those people remain undiagnosed. So it's highly prevalent in society and undiagnosed. And then we have this kind of mouth taping craze, which is blocking up an airway. Obviously, obstructive sleep apnea reduces the amount of oxygen that's going in the blood. You could be starving the brain of oxygen and other vital organs. And certainly, undiagnosed OSA over long periods of time may be very damaging for health. So it raises your risk of heart issues, stroke, gives more difficulty controlling diabetes. You feel you can have higher blood pressure, which is just, I'm going to just pick up and remember that 2 weeks ago we were saying get your blood pressure checked. So let's just remind everyone again. Last week was know your numbers. So if you haven't checked if you've got high blood pressure, go and do it. But yes, if throughout the night it would be cautious to have some sort of blood pressure monitoring, have your oxygen saturation monitored, and have something called heart rate variability monitored as well, if to make sure that you are breathing healthily and your body is in a healthy state throughout the night. But snoring, there is lots of different types of ways to relieve snoring rather than blocking up your airway. In fact, whenever people have studied mouth taping, they've created this mouth puffing, is what they've called. So people still try to breathe through their mouth, but now it's obstructed. And if you have OSA, it's doubly, it's even a greater problem. But if you have an appropriate mattress pillow set, that's going to help. If you can sleep on your side, so that you might think about placing a pillow between the legs to prevent you from rolling over. That's going to make a dramatic difference in your breathing. But of course, your lifestyle will make a huge impact in your snoring ability. So if you can live a more healthy lifestyle, reduce weight, don't smoke, have only little amounts of alcohol, that's going to help with the snoring and potentially save a few marriages at the same time. So I think it's best to look at like these natural treatments as opposed to the fads that are going about TikTok and others.
Yeah, and just one final point. How would you know if you had sleep apnea because you'd be asleep? Could you observe your partner? Would your partner know if you had sleep apnea?
That's a great question. So there's a screening tool. It's a very quick screening tool called Stop Bang. It's an acronym. So snoring. Do you snore loudly, loud enough that you'd be heard through the wall, particularly? So these are all high risk factors. Tired all the time. So if you're feeling tired, fatigued, or you're falling asleep during the day, that means your sleep quality is very, very poor at night. So if you've got daytime fatigue and sleepiness, that's another high risk factor. What you've just mentioned there, the O stands for observation. So if somebody is seen or heard you stop, breathe, choke, gasp, clamour for air, or just have unusual breathing, then that's another high risk factor. And then the fourth one, the P for the stop is do you have high blood pressure? Those are the four critical ones. And if you're clocking one of those four, I would urge you to be to go and visit your GP and potentially get yourself screened for sleep apnea.
And what can you get? What's the cure?
So there is cure. What the primary cure for is called CPAP. So CPAP stands for continuous positive airway pressure, where it's basically it's an oxygen mask that you wear through the night. It's very it can be very, very uncomfortable, but people get used to it very quickly, and that can be relieving. But the primary way of removing sleep apnea is like dropping your weight, changing your lifestyle, getting into healthy habits, all the stuff we talk about, and that's the best way. Okay. The other four, I'll go very quickly through the other four. So body mass index, if you're a heavy person, if that's high. If you're older than 50, that's another risk marker. If your shirt size is 16 inches or greater. That's another one. And if you're male as well. So those are 4 other risk factors, but the first 4 that I mentioned there are the main ones. But if you're clocking 4 or more, yeah, definitely go to consider getting yourself to the GP for an OSI screening, and you may end up with CPAP and lifestyle advice, and then that can be a way to get over this serious condition.
Okay, Johnny, thank you. So worth considering, worth thinking about, but please don't tape up your mouth. Right, it's gone 11:30. That is Dr. Johnny Bloomfield from johnnybloomfield.com.